So now, everyone, I would like to take you into a small journey. Let's say it like this. We started together. First of all, I would like to ask everybody, please, can you put beside your name, your institute, and the city or the country you are living? Because I see that some friends from Indonesia, Egypt, Saudi, and our friends in Africa, they are all here. So I think it's very good to see who is in the call from which country and which institute. This is really will help a lot. So I will not give you results from research, because I would like this session that we think together what we should do in One Health, because One Health is a very important issue nowadays, and a lot of people are speaking about it. If anybody tell you that you should do this to make your research fits for One Health, it's wrong, because we have a lot of discussion about the One Health. And if we really said, okay, what is One Health? Everybody tell you, okay, One Health, that health of human, animal, and the ecosystem all matters, all equal, and we need to take care of all of them. This is the general definition of One Health. But actually, One Health is searching not for a classic approach, but for integrated approach. Because usually we ask ourselves, what do I have to do? So for example, if you are having an animal disease problem, we look at it from the veterinarian side. Human disease problem from the human side. So, but integrated approach in One Health tell you what needs to be done. What needs to be done. And in this moment, animal health, human health, other discipline, other sector come and play together. And this is also what GLOHRA did, because what GLOHRA, when started a few years back, this is their idea. The idea to have more multidisciplinary or interdisciplinary or integrated approach or implementation approaches. And this is what we miss in science. For a long time, we're all speaking about, antimicrobial resistance, but from only one perspective, not the integration of multiple view into the story. And the first thing I will introduce to you, this only one slide, we have ADAPT. It's a One Health network in Africa funded by the Federal Ministry of Education and Research. And we tried in this project together with countries from 7 Sub-Saharan African that we have this kind of approaches, not thinking from animal side alone about the antimicrobial resistance, from the human side, we include the environment, include the in-between, and all these stuff integrated in one system in order to capture the One Health from different aspects. And now, if I ask you, is One Health new? Can you ask yourself, please, is One Health new? No, One Health is not new. Almost 2,000 years before Christ, since I'm originally from Egypt, I'm telling you this, so I don't know if this is a Egyptian civilization, but you see, it was really the chimera between human and animal was mentioned. Vector-borne control using an approach where animal and human is protected is really was mentioned long time ago in this papyrus. So this means it's not new. We actually just give a definition for it. That means the One Health was first mentioned in 1976. That means also is not new. So what I'm saying is that over the years, we have developed this One Health was there, but not under the big umbrella of One Health until 1976. And also recently, the World Health Organization, the FAO, the Animal World Health Organization, and the UN Environmental Session, they come together and make One Health joint plan of action. And this is very important, because if we see the One Health plan of action, the most important thing of this plan is what we call the 4 C's. How we can communicate, how we can collaborate, how we can coordinate, and how we build capacity building. And this is the 4 C's: communication, collaboration, coordination, and capacity building. And this is what we need nowadays. If you would like to work animal, human, and environment, we need to have this 4 C's concept in our mind, because we need to communicate together, we need to coordinate between different disciplines, we need to coordinate the work between each other, and at the end, we need to be sure to build capacity for the One Health. And if you see, this is the 6 tracks that this 4 quadripartite, 4 organization come together and did. We need to build first capacity. We need to focus about re-emerging zoonotic diseases. We have nowadays mpox virus, which is a big problem. We need to be sure to control and eliminate zoonotic, neglected tropical disease and vector-borne diseases. We need to work together on food safety. We need to work together on preventing pandemic for antimicrobial resistance. And we need to be sure to integrate the environment in all the work we are doing. And for that come an important part of this presentation. And please focus now, because we'll speak about what are the challenges we are facing. Please, we will have a networking session after my presentation. So please just keep in mind, what's the challenges you have locally on One Health. I have listed here some challenges and we go through them. The first challenge is capacity building, because if I told you what is the capacity building to build for One Health and which capacity, because if I told you capacity, everybody look to this figure. This is capacity building, but this is actually not capacity building. It's just very tall building, very nice, air conditioned, everything is good. But if this is the capacity building we want nowadays, or we need different capacity building. And actually, we need this kind of capacity building. Capacity building, which mix between nature motor and high tech. The high tech now is become German technology like Volkswagen, but this is what we need. We need to be sure that if we build capacity, we build a high tech technology, and at the same time, be sure to use nature motors. And this is now come our, as in the introduction by Rebecca said, that we have developed what's called a mobile suitcase lab, is powered by sonar panel and power pack, and you can do extraction and detection molecular tests directly in the field setting. And we have integrated in this suitcase lab, as you see here, completely novel technology. So we don't say, okay, let us copy what's in the lab to the field. No, what we have integrated completely novel technology in this suitcase that we can operate the whole lab in less than 30 minutes. And you can detect molecularly many pathogen using either the SwiftX technology or the isothermal amplification recombinase edit amplification assay. We have implemented this technology in many countries, and it's listed here. And some of the people we collaborate with is in this call now, listening to this. We have integrated this in many countries for many diseases, and it has been successfully helped in elimination, like Leishmania donovani, for example, in Bangladesh, helped in outbreak like Ebola virus outbreaks and several outbreaks, and now we have integrated it since few years for the mpox virus. I would like to draw your attention, if you're speaking about One Health, that nowadays we need to be sure to, let's say, catch, we name it catch all surveillance. And catch all surveillance, instead of you go in a hospital and test each patient for AMR, if you test, for example, the wastewater coming from the hospital, you know the AMR status in this hospital. And the same can be happen for a city. If you screen the AMR in the main waste management or waste treatment plant here, you be sure that you detect or capture as many pathogens as you can. For that, we need to move from individual testing to population testing. And instead of testing individual human sample, you can test wastewater, you can test slaughterhouse disposal. And by this, you know the situation within a community or within the country without really need to test each and every person. And we have also a friend from IS Global, Chafi, I hope he is in the call, and he just placed a big fan or collector of air on the roof of his lab and just follow up in Barcelona how COVID increased or decreased using this only fan in the top of his institute. For that, if we need to do this stuff, instead of testing each and every patient, we can really do what's called it's called catch-all surveillance, or we can do this population surveillance. We are doing this in a form of an EU project. It's called Prepare TID. It's a network for rapid diagnostics, and it contains almost 20 partners from over the globe. And what we are doing, we are trying, if you have a novel pathogen, from discovery to result delivery. That means we can really capture the sample, identify which pathogen is there, develop rapid diagnostic for that, and at the end, we have also One Health digital platform, because when we screen, we don't screen only human or animal, we screen both and the environment. For that, this digital One Health surveillance platform or result delivery platform, we are missing this. And within this project, we are trying to establish this kind of forms. And our idea for capacity building, I'm speaking about the capacity building, especially in diagnostic of One Health perspective. I like the 4Ds concept. You see, we speak about the 4Cs a few minutes ago, and now we speak about the 4Ds. And 4Ds, we need to be sure that the diagnostic is decentralized. This means we need to give, like COVID, rapid diagnostic in the hand of the public, and they need to test themselves and have the results in a very short time. Our problem, if you collect sample from the patient or from the animal, you give them 1 week, 2 weeks, 1 month until you deliver the results. The people will die before even they know the results. This is in the Facebook, FaceTime, and Twitter time or X time. You need to have delivered the results in maximum half an hour, because the people are not patient anymore to wait for their results. We need also to be sure to deliver the results to poor resource setting. We always have a center in each country or each city, and this center, they have all the facility, but all the surrounding here, they have nothing. Even here in Germany, all the surrounding, you need to travel or need to go to collect the sample or to give the sample. So we need to be sure that to deliver it to the remote zone. And the most important thing nowadays, we need to decrease the production and operation costs. We need to be sure to build capacity of production, not in each country, but we need to create hubs. We need to be sure that we create hubs in different countries, and these hubs is responsible for production for diagnostic, for vaccine. We know it now that Africa is leading now some vaccine production and some diagnostic production, like what's happening in Institut Pasteur de Dakar, Senegal. We need to improve that. We need to push that, because without having local production in several countries, we'll have problems. The second challenge, and this is after capacity building, how to translate science into public health policy. For a long time, and now we can see in the last, let's say 50 years, we have a problem that science, we as scientists, we would like to just do the science, what we are doing, for publication. This is completely wrong, because your publication nowadays, nobody read them. The people read more posts on Facebook or X than reading your publication. For that, how to be sure that your research in the lab can be translated into public health policy? And you can see during COVID time, the public, they have problem to speak with scientists, because scientists speak different language than the public. And this is very wrong. If you cannot speak the same language and try to simplify the things and to try what you do in the lab to make it in the form to deliver it to a policymaker, communicate with them, share research result, organize meeting face-to-face, adapt a long-term perspective. You need to do that, because if you don't do that in your work, you will have a problem. And if you're one of the take a fund from the GLOHRA, you know that because GLOHRA, they have people, there is not advertisement, but in January, they will have this advertisement of projects or funding, or maybe Lee can correct me if I'm wrong. But you see, this funding scheme is very unique because it's ask you how you will deliver your results to the policymaker toward the end of the project or during the project. Because you cannot just do research for fun. We need to have research for direct impact, and the public must use it. Because if you see, the university has been established, a research institution is to serve the community, not to serve the publication. And now collaboration. We have a big problem with collaboration if you speak about the challenges. Because usually, if I ask anybody from our friends, let's speak about Egypt and tell them, okay, guys, let's go to, we have a meeting in Germany, you will see that the meeting in Germany is overbooked. If you tell them, okay, let's go to the meeting in Sudan or Bangladesh or Uganda or Senegal, then the meeting is empty. We have a problem that we always look toward the north, but we don't do what I'm calling triangular collaboration. We don't collaborate as teams from different countries to see the different perspective. Nowadays, like Inbox, starting in DRC last year, starting spreading in Africa, and if we don't help Africa from Asia and from South America and from Europe, then the disease will spread everywhere and we cannot control it. For that, we need to have this triangular collaboration. And triangular collaboration include also a collaboration within the institution, like government, to collaborate with the government, to collaborate between ministries, the various ministries, to try to decentralize your actions. And also collaboration with international partners, like the WHO, the donors, the NGOs. We need to have this kind, not only sitting in a laboratory, in a university or a research institution and said, oh, my work is beautifully, I have published a very nice Nature paper, or I published whatever MDBI paper. And at the end, who profited from your paper? Zero. Because you don't collaborate, you don't do this triangular collaboration, and you don't include multiple levels of collaboration into your work. The other problem we are facing is involving the community. We have created like a big fence, scientists working in the university. Yeah, I'm a professor, I'm a PhD, let's do this work, blah, 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 la, 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 blah, blah, blah. And at the end, have you involved the community in what you're doing? Zero involvement of the community. We need to work hard in all our research to engage the community. I ask always anybody come at a PhD or master, have you sit with your family and discuss them your project? Then some people told me, oh no, they will not understand. If you don't understand, then this is your problem, not their problem. Because your role is to serve the community. And it's very important to do community engagement from the start of the project. And you need to be sure that to empower the community, to try to solve their problems. The big scientists like Pasteur, for example, developing of rabies vaccine, he was not just working in the lab to develop a vaccine. He developed the vaccine because there is a problem in the community, and he is trying to help and support the community. You need to be sure that that the community is participated in what you are doing from any action. You need to be sure that the community feel that they own your research. This is very, very important in order to make it, to make a research, especially in one health field, while empowering the community for this work. We have a new concept, not a new concept. We have a citizen science. And everybody ask yourself, what is citizen science? For example, let the people collect the data. For example, monitor mosquito, like mosquito ID, monitor ticks, monitoring the air quality, monitoring the pollution. You can get tons of data if you let the public collect the data, send it via app. And nowadays, we have the phones and this stuff. It's very easy to get a picture, and instead of post it on Facebook, if we create this kind of citizen science where the public send you the photo and you analyze it and you engage with the community and you solve their problem, this is much. And please try to integrate this citizen science into your upcoming project or research. We have another big challenge. and I will tell all the people teaching in the university. If you see the teaching 200, 300, 500 years ago on the left-hand side, it's exactly the same like now. Everything in the world has been developed, but our teaching is still the same thing. 100, 200, 1,000, 5,000 people sitting in a very nice room, looking to a screen or looking to something. This was in old days like this, and nowadays we have PowerPoint, we have videos, whatever. But we didn't change the way of teaching over the last few hundreds of years. Our teaching is really not changed at all. We need to integrate innovative way of teaching. For example, in this one course we teach at Veterinary University in Cairo, we have created a One Health student course where it's more interactive, more about problem-oriented. And at the same time, you will not believe it, we have created part of this course to make social media campaign on One Health. And for that, the student, instead of they are speaking on their stuff or having this classical way of teaching, they become more engaged, use the social media as a platform to distribute true information about One Health, to interact with the community in a special way, and to really try to solve problems which happen in the community. And this is what's called interactive lecture. The way we teach that, let us give the people, for example, today I will come speak with you about lecture about, for example, inbox. The people can read Wikipedia. The people can go to Gemini or GPT chat and then say, okay, I need to summarize the inbox situation in the world. You will have a very nice information. But what we need to do, we need to be sure not to give information, but to empower their thinking and their way of interacting in order that we see our lecture halls full again, not empty as nowadays. Or the people got pissed off, or they don't want to hear this very classical, over the 100 of years, we didn't change our classroom. The other big problem from this global health challenges, and this is the last one, global initiative, how to link your research to global initiative. In all countries, in the whole world, we have what's called 2030 vision. Each country has its own vision. And we have the 17 Sustainable Development Goals. And if your research will not support the country vision, the global vision, then is your research is supporting only your publication, which nobody will read it. Or another scientist will read it, another scientist will read it, but it will not help the community, it will not help the country. For that, please try to link your research to the vision of the country or the vision of the global vision, like the Sustainable Development Goal here. And if you see these are the goals, if you work on One Health, these goals can be really fits for your research and for your work. Group 1, no poverty, zero hunger, good health and well-being, gender equity, clean water and sanitation, reduce inequity, responsible consumption and production, climate action, and also partnership with all goals. And these are the goals you need to focus if you are working on One Health. And I would like to tell you a few successful stories toward the end of my presentation. The one successful story is that try, for example, to use one lab for analyzing human, animal, and environmental science. Because our problem, we said this is human research, this is animal research, this is environmental research. But actually, if you see, all of them has a sequencing machine, real-time PCR machine, whatever. We need to be sure that to integrate One Health approach in our labs and what we are doing, and we can commonly share the labs in order to do that. The other successful story is rabies. If you see in this graph from the Open WHO platform, and please go to this platform, they have a very good teaching materials, and you can have a very nice e-learning courses. If you see South America, by vaccinating more dogs, they succeeded to decrease very sharply human disease. That means the focus now in all country, if anybody bitten by a dog, go and take the vaccine. This is the strategy now for all countries. But a better strategy to invest in dog vaccination, and by investing like South America, you decrease the human losses. You see in Africa, investment in dog vaccination very low, and as you see, human disease due to death of rabies is very high. For that, you need to invest sometimes in animal sector to protect the human sector. Another good example, in Chad, for example, in Chad, they have this nomadic group where the people move with animal in different locations. And these people, if you tell them, we need to vaccinate the animal, yes, animal is very important. Children vaccination, no, animal is more important than human for this community. But what they did over the last few years, they used the vaccination program for animal in order to distribute vaccine for children, and at the same time, do both animal and human vaccination. You see, they share resources, they decrease the cost, the logistic for vaccine transport is the same, don't need to do, and by this you protect both human and animal. And we need more of these examples. At the end, I would like to you one health concept where human, animal, and environment matters. We need to be sure at the same time that we have a lot of challenges. And I listed the challenges here. We need to be sure to build the right capacity for this. We need to be sure to translate our science into policy and into health policy. We need to be sure that we do more collaboration and more diverse collaboration. I call it triangular collaboration. We need to be sure to involve the community in the research we are doing. At the same time, we need to really start thinking about innovative teaching method, because our teaching nowadays is very, very old, not up to date. We need also to be sure while we're doing our research to link all of that to global initiatives. This is very, very important. And I would like to ask all of you, what's research mean for us? Ask yourself, what research mean for you? I can tell you, research for us means holidays. Why? Because while doing research, you meet family and friends. We become a big family of researchers. We have fun in discussing our research. And we do what you like most doing research. This is what you do all the time. And at the end of the day, you get motivated and regain power. And this is research for us, is holidays. So everybody enjoy your holidays with doing a lot of research, and at the same time, think globally while acting locally. And nowadays, we cannot only think this is US alone, this is Germany alone, this is Uganda alone, this is Bangladesh alone. Whatever happened in any country, this is China, whatever, it affects all of us. For that, please think globally while you are acting locally. At the end, I would like to thank all international partners. We work over the year with them and develop these research ideas and come up with these challenges, which we push hard in order to overcome all of them and try to produce a good and reasonable One Health research. And at the end, this is my contact information. You can now use this QR code to scan it with your phone, and then you can have my contact information if you would like to speak with me about anything or has a relation with One Health or with research in general. Thank you for the GLOHRA Academy Series team for inviting me, and thank you for all of you for listening. And please think about what challenges we need to be addressed in One Health during the Q&A session. And thank you very much.